Hi everyone, thanks for joining us on this Tuesday. Today we are live in McPherson, and I'm joined with Amanda. Amanda, you want to give a quick introduction?
My name is Amanda Knoll, and I'm a physical therapist here in McPherson. My main focus and joy in physical therapy is working with athletes, so that's kind of why I got into this, and I'm also a certified strength and conditioning specialist, so
That's awesome.
incorporate that a lot into my treatments.
That's awesome, and that is today's topic. We are talking about how physical therapy is and can be tailored to every patient, but specifically towards athletes. And so we thank you for taking time to join us. Hi, Whitney. Really appreciate you guys taking some time out of your Tuesday. If you can hear us and see us okay, give us a thumbs up. If not, give us a thumbs down, just so we can make sure that we're getting you the information. So to start out, I guess we should talk about the topic. So how would an athlete's treatment be a little bit different than maybe your average patient?
So athletes are obviously more active than your average population. So we're
Right.
going to tailor their treatments to be a little bit more dynamic, a little bit more explosive, making sure a lot of them are doing a lot of lifting, so making sure their lifting technique is correct, and then tailoring it also to their sport. So whichever sport that they are in, if it's especially if they're a pitcher, and then just seeing what the demands are for their sport and tailoring their treatment to them.
Could we maybe talk about two sports or one or two sports, just to kind of maybe look at what a treatment would look like for them?
Sure. One of the more difficult ones, I guess you would say, would be a baseball pitcher. Just because their movement is so dynamic and so complicated, you really have to assess them from the head down. It's not just their throwing arm, it's not just their elbow or whatever is hurting them. So when I eval a baseball player, I actually start at their hips, because most of their issues are going to come from lack of hip strength, lack of core strength, their arms trying to do way too much, and that's where they get their injuries. So for them, I don't think that's one thing a lot of parents are surprised about when they come in here, and I'm looking at
Maybe. Aha! Okay. We're back. Sorry about that. It was recording, so I think it'll play for us. But just a brief overview. She was talking about how baseball players, their movement is so dynamic that a pain or an injury in their elbow could really be root cause in their hips. Yep. So she was talking about how we really need to make sure we're looking at all aspects of the movement.
Yes.
So that's on baseball players. Maybe what's something else.
So like for trying to think.
I feel like that would be kind of the same for football players too.
Probably the same kind of thing as quarterbacks. Yeah. Like runners, you're going to run into more of the overuse injuries, so tendinitis, plantar fasciitis, anything that's really inflammatory, you're going to probably see those more than runners. And again, a lot of their problem also comes from their hips not being strong enough to control their lower body. So if they just run and they're not strengthening, then that's where you're going to run into a lot of problems for runners.
So there's a lot more than just treating an injury.
Right.
You're really treating a pattern. And I'm sure for a lot of athletes, they've been throwing the same way since they were throw.
Yep.
And so it's retraining them how to do that properly, or strengthening those muscles to help them with that.
And a lot of pitchers are just pitching too much a lot of times, because you think throwing a ball can't really hurt you throughout the year, but pitchers actually really need 2 to 3 months of no pitching at all.
What?
For their elbow to remain healthy, because if they tear the ligament on the inside of their elbow here at a young age, their pitching career is pretty well over or very, very delayed. So
you hear of those, is it called a Tommy John?
Tommy John, yep.
Is that something that can be prevented with the not pitching?
It can, yeah. The if they take care of themselves and follow the pitch counts that the Major League Baseball has set out for the high schools and colleges, they don't throw certain pitches until they're a certain age. If they keep everything strong and then take that break each year, they're not playing year-round ball, that can be definitely prevented, or their injury risk goes way down.
Yeah, that's crazy. It looks like we have Hugo watching. Hey, Hugo. And Heather's watching as well. Thanks for taking some time out of your Tuesday, guys. We are talking about how PT can be tailored towards athletes, which we do tailor all of our treatments to patients specifically, but athletes are kind of a different breed.
Yes.
And we want to make sure we're offering them